So let's talk a little bit about migraines. Migraines is one of the biggest health problems, especially for women in the United States. There's so many hours of missed work, and a lot of times people, you have a migraine, it can take you out, for days sometimes. So where do migraines come from? Well, one thing I can guarantee you, it's not an Imitrex deficiency. It's not Excedrin, Tylenol, or migraine. It's not, there's not a drug deficiency that causes migraine. So taking medications, although it might give you some relief, never going to fix the problem, obviously, right? So where do they come from? Well, migraines are caused within your body. How could that possibly be? Well, so the mechanism for migraine is the blood vessels that supply blood to your brain are constricted or closed up, and your body's trying, your heart's beating faster, trying to push more blood to the brain. Well, the blood vessels are small and they're not opening, so you're trying to push a lot of blood through a small opening, and those blood vessels don't like it. So they get irritated, they get inflamed, they get painful, causing a lot of the headache. Then you get a lack of blood flow to the brain, which can cause auras and a lot of other issues. Now, how do you correct that? Well, we have to make sure that the blood vessels are functioning the way they're intended to. How do we make sure of that? Well, so the nerve system is what controls the blood vessels. Now, you don't have any nerves that come off of the brain itself, okay? You have 12 cranial nerves that come off the brain stem on each side, and they go back up and innervate the head, face, and neck. Well, here's a model of what that looks like. So here's the head. Here's the first bone and the second bone in the neck. The brain is here, obviously, and the brain stem comes down to the bottom of the second bone, then the spinal cord the rest of the way down. Well, the nerves, the cranial nerves that go back up into the head, face, and neck come off of the brain stem and go back up into the skull, where they come back and innervate whatever needs to be innervated. So, for example, the nerves that innervate the blood vessels that supply blood to the brain, if one of these bones is out of a line, kind of like stepping on a garden hose, it diminishes the message from the brain to the blood vessels. So when the brain says, I need more blood, and heart speeds up, starts pushing more blood, but the blood vessels never completely dilate, then you don't get the symptoms of a migraine, because you're trying to push the blood through there. So what we have found is a misalignment here could be interfering with the messages to the blood vessels. If we can find it, and if we can open it up, so now, like taking your foot off the garden hose, now the message gets to the blood vessels the way they're supposed to, then the blood vessels now will open up or dilate and allow proper blood flow. So for one, you can stop the migraine, and if maintained, we can prevent future migraines. So that's how a problem in the upper cervical spine could be creating migraine headaches. So if you have migraines, or you know someone that does, please share this video and help them possibly get some relief. Find an upper cervical doctor near you. If you're in the Charlotte area, call the number on your screen. Give us a call. We never charge for a consultation. We'd love to come in and talk to you about your needs to see if maybe an upper cervical misalignment could be causing your migraines. If so, we're going to explain to you what we need to do and how we can correct it. If it's not, then we're going to find somebody else that we think can better serve you, so that one way or another, you're going to get some help. Thank you for tuning in. I look forward to seeing you.